complications that may be associated with alemtuzumab?
Sure, absolutely. It's my opinion that we need to put people with MS on the most effective drug they're comfortable with as early as possible. It's my opinion that alemtuzumab, codenamed for Lemtrada, is one of the most effective agents that are currently available for people with MS. And we have to explain the risk-benefit of any drug in the context of the risk of the disease. And so I start the conversation not by talking about autoimmune risk of Lemtrada, but talking about what happens if we undertreat your MS. We have to put that context out there before we can have a more granular conversation about the drug. Lemtrada is a highly, highly effective agent, and it's very, very complicated. And we now have a better sense of what some of those complications are. I don't think that we should shy away from the drug. I think that we should lean in and have more in-depth conversations. We need to be more upfront and say, listen, this is not child's play, this is serious. And if we're going to do this journey together, if we're going to do Lemtrada together, we have to consider what's coming down the line, and we have to consider very openly and very honestly what those risks are. And we have to be willing to monitor, and we have to be willing to communicate and look for them. I want to point out that those autoimmune risks are treatable. And so it's not a death sentence. I'm not saying it's nice to lose your thyroid. I'm not saying that at all. But we can supplement that. And so at the end of the day, there are some patients that are willing to accept upfront risk and complexity in exchange for a chance at, and I'm going to say the word, remission. Right? And there are other people that are simply not comfortable with that. And there isn't a right answer. And so I want to be very open and honest. I want to share the good, the bad, and the ugly. And if that's something that one individual says, no, okay, that's fine. And if another individual says, keep talking, doc, I'm going to keep talking. I think the more we know about a given therapy, the better we can do at setting expectations, the better we can do at being prepared and informing the patient. And maybe if I gave you a much shorter answer, I just think that we need, as doctors, to do a better job of explaining the risk-benefit.
So one more question.
Sure,
So,
you can ask too.
Oh, thank you. So, what do you think people with MS need to know about ECTRIMS 2019?
I want people impacted by MS to know that there are 10,000 providers gathered here so that we can up our game and do a better job of taking care of them. I want them to know that they're not alone. I want them to know that there's a giant community that's fighting. And this is the Olympics. For me, this is where I come to communicate, to exchange ideas, to go home with better understanding, and it ups my game. And I take that back to Columbus, Ohio, where I can hopefully translate that into better patient care. And I want people with MS to realize that they're not in this fight alone, that we are here so that we can do a better job when we go back.
What is the most, if you were to pick one thing, most exciting research finding that you've heard here at ECTRIMS 2019, what would it be?
The most exciting finding is going to come out this afternoon
Ooh.
in the late-breaking session. So ECTRIMS is an anti-B cell therapy, and we're going to get the readout in the phase 3 trial. And so you're going to see a room with thousands of docs on their seat's edge waiting, and I'm going to be one of them. And that's the most exciting thing that I'm going to get out of this meeting, and that's just in a couple of hours. I can't wait.
So I've just spoken to Aaron Boster about his take-homes from ECTRIMS, and one of the things that really stood out to me from that conversation was how ECTRIMS is a chance for the scientific and medical community to come together to make sure that they are treating their patients with the best possible care, and it's really empowering and it's really quite emotional for us to know that they're here and they care so much about that, because it can feel a little bit disconnected from time to time and your clinical setting can feel quite cold, but to know that behind all that these professionals really do care and want the best for us.